Good afternoon and welcome to the Health Subcommittee. I'm going to call our hearing to order. And I believe our Chair of Finance is here. So, Senator Lucas, please come forward, and your bill is Senate Bill 119, is that correct?
Yes, it is, Madam Chair, members of the committee. If I could turn your attention to Senate Bill 119. Madam Chair, members of the committee, Senate Bill 119 addresses the unfortunate challenges arising from some key pharmaceutical manufacturing arbitrarily limiting shipments of 30B discounted drugs to one pharmacy or contract pharmacy per federally qualified health center districts. Senate Bill 119 simply says that as a condition for receiving or renewing a permit for Virginia manufacturers or registration for out-of-state manufacturers, a manufacturer must certify that it does not limit the number of locations to which it ships 340B eligible drugs. Madam Chair, members of the committee, the growing practice of manufacturers to restrict shipment of 340B drugs to a single location for a community health center is creating an access crisis for the 360,000 Virginians that CHCs annually serve. These restrictions are also impacting the 340B savings that CHCs rely on for an average of 30% of their funding. CHCs put 100% of the 340B savings back into services. Community health centers account for about 5% of that total spend nationally in 340B drugs, yet are disproportionately impacted by these restrictions. And I have a lot of other information, but I have people here who can respond to some of the questions that I think you will have. And so with that, Madam Chair, members of the committee, that is the essence of the bill, and we'll be open for any questions you may have.
Thank you, Senator Lucas. Before I can comment, I have to open the roll, just so everybody knows.
I'm sorry, did I just jump in before time? Thank you.
Senator Durant. Senator Aird. Senator Bagby. Senator Suderline. Yes. Senator Favola. Yes. You have a quorum, Madam Chair.
Thank you.
Do you want me to repeat what I said?
No, I do not, Senator Lucas. You were loud and clear.
Thank you.
And actually, I think very succinct in your presentation. I expect there are people here who do want to comment.
Yes.
For those who want to speak in favor of the bill, you have 5 minutes. For those who want to speak in opposition, you have 5 minutes. So you can decide. It doesn't, I said it's not 5 minutes a person. It's 5 minutes to make a case in favor, and it's 5 minutes to make a case in opposition. So if they're expert witnesses, it might be wise for them to come up first so they can provide as much information as possible. If you get one speaker who takes all the 5 minutes, then that's your pro side. Everybody understand? Okay. All right. Those in favor, please come forward and speak to Senate Bill 119.
Madam Chair and committee members, my name is Basim Khan. I'm a primary care physician and the CEO of Neighborhood Health, a community health center in Northern Virginia. We have 14 clinics, serve about 40,000 patients, half of who do not have health insurance and the other half of Medicaid. We serve more uninsured patients than any community health center in the state. As a practicing physician for 13 years, the 340B program has been a lifeline for our patients. They rely on this program to get access to medications at a pharmacy close to where they live. However, this access is now threatened by the actions taken by manufacturers against contract pharmacies. Community health centers like ours only have contract pharmacies, so these restrictions have placed undue hardship on patients who cannot get their medicines at their closest pharmacy and have to travel long distances to get medicines that they've had access to for months or sometimes years. They've had to take time off work, they've had to pay Ubers or taxis to get their medicines. And we, just our health center, have seen hundreds, if not thousands of patients who have, because of this, not been able to get their medicine or have had delays. Doctors have had to change their medications because of these actions that have happened over the last few months. So we urge you to support SB 119. We're talking about life-saving drugs, drugs for diabetes, inhalers for COPD, blood thinners for blood clots. And we feel like the rug has been pulled out from under us all of a sudden, where patients who've been getting these drugs for years are not able to get them anymore. It has also decreased revenue that support our very doctors and nurses who are now struggling more to provide access to these medicines. So once again, we urge you to support SB 119. It's a lifeline for our patients, as is the 340B program. And that's all I have to say. So thank you so much.
Thank you, Dr. Khan. If you want to come forward and state who you are and what group you're representing, if you are representing a group, and I keep your comments very short. I think there was a good presentation by Dr. Khan, so add to that information.
Hi, my name is Ashley Slagle-Perry, and I am an LCSW and Chief Operating Officer of the Community Health Center of the New River Valley. Our health center serves individuals in Montgomery, Pulaski, and Giles counties, as well as Radford City. Our service area includes 1,100 square miles, which is very vast and mountainous. In a nutshell, I represent a community with a higher than average rate for chronic conditions, poverty rates, and significant transportation barriers, and one that is rural, mountainous, and clinically underserved. All these challenges have made it insurmountable with the restricting of 340B medications. I'm here today in support of Senate Bill 119. Our center does not have an in-house pharmacy and must rely on the 340B contracted pharmacies to dispense medications. Over the last year, as drug manufacturers have begun restricting the shipping to single contracted pharmacies, we've had to make the impossible.
We only got 2 minutes left for everybody else to listen.
Sure.
Feel like the Detroit Lions against the 49ers on Sunday. My name is Charles Albaugh. I've been the Chief Financial Officer for 29 years at Central Virginia Health Services, which is the largest health center in Virginia. We're a mixture of urban and rural sites, and we have a vast geographic area. And I echo what my colleagues were saying about only limiting it to the contract pharmacy to one. It's just not feasible for our patients. And I do want to just leave you real quickly with a patient story. We had a patient who was receiving chemotherapy medication from Sam's Club. They were paying $350 a month for it, but she wasn't able to take it because of the cost. After we talked to her and got her on with our pharmacies, it went down to $3. And that's what we use that money for, is for our patients. So thank you.
We're down to 1 minute for 4 people.
Hi, my name is Stephanie Krenrich. Oh, sorry.
No, it's okay.
My name is Stephanie Krenrich, and I'm with Advocates for Community Health, a national membership organization for community health centers. Restrictions on community pharmacies or restrictions on contract pharmacies hinder access to care for vulnerable populations, and we strongly support this bill. So please support SB 119. Thank you so much.
Thank you.
Becky Bowers-Lanier. I'm president of the board of directors of the Daily Planet Health System here in Metro Richmond area with a federal designation of providing health care for the homeless, and we support the bill.
Thank you.
Good afternoon. Thank you, committee, for allowing us to speak today. We greatly appreciate your time. My name is Will Coleman. I'm a pharmacy director with Piedmont Access to Health Services based in Danville, Virginia, and we too would greatly appreciate your support of Senate Bill 119.
Thank you.
Thank you for the opportunity to speak. My name is Tony Pratt. I'm the Chief Operating Officer with Piedmont Access to Health Services in Danville, Virginia, and we also support. Thank you.
Okay.
I'm sorry, Madam Chair. I'm the oldest of 7 children. I can't help taking over.
No.
I
think your speakers did a good job.
Thank
now
you.
I need to hear from the other side.
That's right. I forgot
and they
about
get
that.
5 minutes as well. So for those who wish to speak in opposition to the bill, please come forward.
Hi, I'm Ann Lee Kerr. I represent the Pharmaceutical Manufacturers, Research Manufacturers of America. I will not take 5 minutes, but I do need my glasses. First, I'd like to say that pharma is committed to the 340B program. I'd also like to remind the subcommittee that the 340B program is a federal program, and if there are issues with this program, it needs to be a federal solution. In addition, I'd like to bring to the attention of the subcommittee that there are 2 states that have recently passed very similar legislation to what you find in Senate Bill 119. And in those states, they're in active litigation, and we ask you not to act on this until these legal issues can be settled by the courts. Thank you.
Thank you. Is there anybody else speaking in opposition to the bill? I guess there are states that have tried to move forward, and we can always wait and see what happens with the courts, but there are many advantages to this, especially in areas that may be underserved or their patients may have transportation issues. The benefit of this bill is really having the drug companies send out their drugs to all of the pharmaceuticals in that catchment area. And they're also sending out discounted drugs because
That is correct, Madam Chair.
3040B is a federally discounted drug program.
Yes.
Are there questions from the committee members? Okay, is there a motion?
Does it need to go to finance?
I do not have a note that it has to go to finance, so I will ask.
You don't need to send this to me. I'm standing right here right now.
Just need to hear that.
Well, should April Keyes at a later time ask us for the bill, we will send it. At this time, I have no note to send it there. Okay, motion has been made to report the bill. Will the clerk please call the roll?
Senator Durant? Aye. Senator Aird?
Aye.
Senator Bagby? Aye. Senator Suderline?
Yes.
Senator Favola?
Yes.
Ayes 5, no 0.
Thank you very much, Madam Chair, members of the committee.
Thank you, Madam Chair.
I look favorably on your bills when they come before my committee.
Well, I appreciate your expeditious presentation. I believe there is another chair, subcommittee chair in the room. Is Senator Locke here?
Yes, I left my committee to be here.
Welcome, Senator Locke. And
Thank you, and there is a substitute.
Okay. And this is Senate Bill 34?
Yes, ma'am.
Okay. Committee, please draw your attention to Senate Bill 34 and the substitute before us. Go ahead, Senator Locke.
And I believe there's a line amendment to the substitute.
Okay. Well, let's adopt the substitute first. Okay. Motion has been made to adopt the substitute. Is there a second? Sure. All those in favor signify by saying aye. Aye. Substitutes adopted. What's the line amendment, Senator Locke? Or staff?
One moment, Madam Chair. Madam Chair, the line amendment adds into the definition of certified evaluator clarification that they
What
shall
line?
not-
I'm sorry, Julie, what line?
What line is it? Just. No, it's. It's in section 37.2-809.
Got it.
Line 225 after osteopathy, comma, who are not emergency department providers. So it's providing clarification that certified evaluators shall not be emergency department providers.
Okay. Is there a motion to?
I'm so sorry, I have a little trouble hearing.
Okay.
Do you mind repeating that? There was some noise from the floor.
Julie, could you repeat that? It's line 225 after osteopathy.
Yes, Madam Chair. It is in section 37.2-809 in the definition of certified evaluator at line 225 after osteopathy. It adds comma, who are not emergency department providers.
May I have a motion to adopt that line amendment? Second. Okay, motion has been made and seconded. All those in favor signify by saying aye. Aye. Okay. I think the bill's before us in the format the patron just wishes.
Thank you, Madam Chair and members of the committee. SB 34 proposes a limited pilot project following the opening of Riverside Health System's opening of the Commonwealth's first and only psychiatric emergency department in 2023. Riverside Health System opened this emergency department, this one of its kind, in late 2023. The Psychiatric Emergency Department is a 16,000 square foot addition to Riverside's pre-existing behavioral health hospital and is staffed with mental health professionals and is specifically designed to care for patients 5 and older who are struggling with mental health and substance use challenges. The intent of this patient-centric legislation is to take this new innovative facility and couple it with new innovative pilot program that accelerates one step in the process of evaluating those in crisis who are a danger to themselves or others, need treatment, and are unwilling or incapable of voluntarily obtaining necessary treatment. Specially trained providers and clinicians working with the psychiatric emergency department would have the ability to perform pre-screening evaluations for temporary detention orders as a result of this legislation. The bill ensures all psychiatric emergency department-based evaluators meet the same requirements of current certified pre-screeners to complete a TDO evaluation, perform evaluations in person, and assume the same responsibilities of current pre-screeners through the entirety of the TDO process. SB 34 is limited to one facility only. It has a 2-year sunset and reporting requirements to ensure this policy shift does not have a negative impact on the behavioral health system. Reporting requirements in the bill align with reporting requirements with those of the community services boards. A version of this bill passed the Senate in 2023 by a vote of 40-0. This year's version of the bill is responsive to conversations with DBHDS and adopts language from DBHDS to define psychiatric emergency department, ensure TDO evaluations are performed in person, incorporate changes to the code as a result of legislation approved in 2023 related to release of a detained individual, and adds reporting requirements that aligns with those reporting requirements. And that is the bill. And there are those individuals who are here to speak to it.
Thank you, Senator Locke. Once again, I'm going to give 5 minutes for the presentation. So 5 minutes for the pro and 5 minutes for the con. So if you have expert speakers, you may want to bring them up first so we get a full explanation, and then other speakers can fill in the time until we get to 5 minutes. Welcome.
Thank you. Okay. Hi, I'm Stacy Johnson. I'm the hospital president at Riverside Mental Health and Recovery Center. So thank you so much, Senator Favola and the committee for hearing us today. So I think Senator Locke did a wonderful job really explaining what our emergency department does. We're really focused on treating the urgent substance abuse, mental health, and psychiatric crisis needs around the clock. So our emergency department is staffed 24/7 with providers, RNs, nurses, and of course, ED therapists. Our emergency department therapists meet the same qualifications as our community service board pre-screeners. We believe this creates a perfect opportunity to really pilot this legislation. So much gratitude to you for sponsoring this. The intent of the legislation is really to put the patient first and at the center of the care. It'll transition what's currently virtual evaluations to in-person care by individuals right there with the patient, and give us an opportunity to really be able to provide this information to the magistrate who makes the final determination for the TDO recommendation. So this saves time, reduces repetition of the patient and redundancy of clinicians at a time when really workforce shortages are fairly significant, and puts the patient first and really expedites the care that they're receiving. So thank you.
Sorry, Stace. I'm trying to hurry. Good afternoon, Madam Chair, members of the subcommittee, Julie Dime with the Virginia Hospital and Healthcare Association. We very much support the bill, and we thank you so much. We thank the patron for her persistence on this issue, and we look forward to the results.
Good afternoon, Madam Chair, members of the subcommittee, Josie Mace, Department of Behavioral Health and Developmental Services. The department supports the bill. Thank you.
Thank you. Is there anybody else who would like to come forward in support of this bill? Okay, well, your speakers took only 3 minutes, so I will allow 3 minutes for the con. In other words, those who are in opposition to the bill.
Thank you, Madam Chair, members of the subcommittee. My name is Jennifer Faison. I'm here on behalf of the Virginia Association of Community Services Boards, and we do oppose this legislation. It may seem like a limited measure, but it has the potential to upend the local system as well as impact
the state hospital system. I have individuals in leadership from the Hampton Newport News CSB who would like to use the rest of our time.
Madam Chair, the committee members, I'm Brian Dudley. I'm the Director of Crisis Services with Hampton Newport News CSB, where I've been employed for the last 26 years. Efforts to address our behavioral health system obviously is a nonpartisan issue, but please be aware that while this may have first appeared to offer some remedy for behavioral health services, we're seeing irrelevant because being one facility. That's not at all correct. Currently, the CSBs are the only ones allowed by the code intentionally to conduct the pre-screening evaluations, despite many formal work groups conducted by Department of Behavioral Health, most recently in December 2021. Authority to private hospitals is requesting, to be clear, is challenging process, but must respect the liberties and the individuals and balance the legal, ethical, and demands of the clinical needs. And if somebody is determined to require TDO, it is affecting somebody's liberties. The CSB's mandated to determine that somebody's least restrictive alternative is always considered. In both 2019, Senate Bill 1488 work group expressed the change would be complex, impacting multiple other processes, and could lead to inadvertent increase in hospital admissions. But such a change has always been indicated would require many changes to the code. And to accomplish such a request for one provider in this situation would require a number of changes, not only to the code, but impact other areas with Department of Licensures, DMAS, and managed care protocols, changes to local, regional, and statewide protocols, and significant adjustment or exceptions related to the certified pre-screener certification that was initiated in 2016 by the Deeds Commission. The code also addresses the financial consideration that an entity that provides the evaluation determines an individual's involuntary hospitalized cannot be affected by a party that has financial interest in the outcome. CSBs are involved in every phase of the behavioral health continuum, but yet we've been left out of this critical discussion. We want to make it known that this bill or any substitution would also directly contradict efforts and the funding the General Assembly has put in the Step Virginia, which is intended to ensure that Virginians have similar access to a range of behavioral health services, regardless of where they live in the Commonwealth. It's also inconsistent with the recommendations of the last two JLARC studies. And so
Sir, I think you've concluded with the 3 minutes. I don't know. I will allow this next speaker, who I guess is the last speaker, because the other team had their speakers all go.
Thank you, Madam Chair.
Yeah.
Thank you, committee.
Yes, I am going to.
Thank you, Madam Chair. I appreciate the opportunity to speak. I am Daphne Cunningham. I'm the Deputy Executive Director of the Hampton Newport News Community Services Board, and I'm just reiterating what Ryan has already shared. We do think that this would represent a shift to our system. We believe that this is a step backwards. A lot has been done to move us forward. There is a reason that CSBs have this responsibility. We think that this would represent a conflict of interest when the provider who is conducting the pre-screening is also providing the service or has the potential to turn someone away. So we think that that definitely is against what we're working toward. And we ask for your consideration in that regard.
Well, Senator Locke, there's a question. Senator Aird.
Madam Chair, Brian or the last guest to testify, I just had a question for the CSBs. I guess it was my understanding to date that there has been a significant backlog among the CSBs, and that both from a workforce standpoint to try and get individuals in front of someone, as well as even the level of just getting the pre-screening conducted. And I thought from this legislation, this would have helped sort of alleviate some of that pressure on the CSBs to allow for a more collaborative approach. And so can you just clarify for me?
Yes, Madam Chair, committee members. Although the CSB do face workforce issues, this does not provide any relief to the CSB. It actually taxes public resources, having two systems to work through, whether it's police or magistrates or special justices. And what I'll say with Hampton Newport News CSB, our pre-screeners have 170 years experience combined. So there's certainly no lack of experience there, as well as we've met all mandates 24 hours a day. There's been no question on our performance contract whether or not we meet people within the certain periods of time, regardless of the environment that they're in, and are working with both cities, both police departments, magistrate. Certainly we think this shift would be a dramatic shift that would
I
many
guess
problems.
that's
Yes,
the
ma'am.
purpose of pilots.
Madam
is-
Chair, follow up.
Oh, Senator Aird.
Thank you. I think I'm going to get at what you're asking. I guess my question, Brian, is Mr. Brian, is for a 2-year pilot, do you think there's some benefit to that? Because it really allows us to get indicators as to this dramatic shift that you're applying, whether or not it has the detrimental harm that you foresee, or whether there's a different approach that we can take. How harmful is a 2-year pilot?
I'm sorry, can I answer that, please? I want to just piggyback off of what Ryan just stated and just state that last year alone, our CSB conducted 3,945 pre-screenings. Not a single complaint did we get that these things were not done in time. Our pre-screeners, our emergency services staff spent countless hours looking for hospital beds as a result of those. So we don't want to conflate those issues. Those are separate things. We need hospital beds. We need people admitted without bias to those beds. That is what our JLARC report indicated. It was not centered around the pre-screening process. The harm that we think will be done is it just creates a system that's closed, not having any external neutral party involved. We believe that it creates a system that ultimately will lead to the most vulnerable people with the highest needs still being served by our CSBs. And so, we just take caution with that.
Thank you, Madam Chair.
I guess my question is, will records be kept? Will there be an evaluation of the patients served, the complexity of their conditions, and then the discharge process? This is a 2-year pilot. I would think we would have enough time to get information we need that may be helpful to the CSBs in the future.
Madam Chair, committees, I'm not sure I could necessarily answer exactly what is being requested or reporting to the Department of Behavioral Health as our performance contract is, in last year's JLARC study, wants to ensure that there's standardization within the process to also ensure that within the pre-screening process, there's a level of fidelity. Obviously, there's a concern that this is necessarily not the case, that we're looking at one entity doing a pilot that will change, the course of how this is provided, working with the stakeholders and ensuring that somebody's liberties in this process is not taken. The role of the CSB is to ensure that the least restrictive alternatives is taken, and part of our training and our experience is the orientation and understanding all the community factors. And so that is something I think risks specific harm.
Let me,
Yes, ma'am.
I would like to ask the patron and maybe general counsel, I've read the enactment language, and there doesn't appear to be an overall evaluation based on our current TDO process, whatever patient protections may be in place, and then access to services. And I would ask the patron if you would be open to an evaluation report coming back to the General Assembly at the conclusion of the pilot program.
Of course, but I also have someone who can address the reporting requirement.
Okay, please come forward.
Thank you. So we worked closely with the Department of Behavioral Health to align our reporting requirements similarly to what the CSB already does. At the end of the day, it's up to the magistrate to make that decision for the TDO, so I want to mention that. And there is a requirement of an evaluation and regular reports and feedback already within the bill that I think should help alleviate some of those concerns.
Right, I noticed that, but there's not a general report about the effectiveness of the pilot that would come back to the General Assembly. And I would ask General Counsel to draft that amendment, and I would hope it be viewed as a friendly amendment. Yeah. And you can read that to me when you're ready, Julie, or...
That's fine.
Is that fine?
Yes.
Thank you. Senator Bagby.
Yes, I would just ask Madam Chair if DHBDS had any insight as it relates to what has been shared.
There was a DHBDS representative here.
Hi, Madam Chair, members of the subcommittee. I'm Megan McGuire with DBHDS. We did have significant concerns about this legislation and worked often and with the hospital to try to mitigate those concerns. We also had reporting requirements that were put in there, and they were very amenable to those changes. So we are comfortable as it stands.
So you are endorsing the proposal as it is?
We are fine with that. If you think that an evaluation needs to go into that, we'd be happy to work with the patron to see what that could look like. We do think that it would be very important to get very good data out of this.
Yes, it would be.
Making it a larger issue is something that we think that evaluation would need to tell
Senator
us.
Bagby.
One last question. Could you describe any conflict or competition?
Or competition, sir? Madam
With the
Chair?
CSBs?
I think that the CSB did adequately describe their concerns. The main issue is making sure that people who are under TDOs maintain their civil liberties and that they are not put in a more restrictive environment than they need to be. And that is what CSBs are trying to protect as the pre-screeners are working on that. So it is a concern, and that's what we're watching.
Is there language in here that articulates that?
I don't know that there is specific language on the least restrictive, but we did put language in to require an orientation to make sure that what's called the certified pre-screeners are adequately trained. And that we think will help that piece.
It might help if the current law is that patients be treated in the least restrictive manner.
Yes,
So if
Madam
we
Chair.
were able to cite that section of the code in this statute, I think that in this proposal, that might be helpful. So that's one other amendment I would ask staff to make. I will ask the patron, we can try to give you good language now, or we could have you come back next week, or we can work this through at the Education and Health Committee. We'll have the amendments ready. We can probably have the amendments.
I would prefer that the amendments be ready for the full committee. Because
Okay.
I have a subcommittee that meets at the same time as this.
Okay, what I'm going to say is I would like the agreement of the subcommittee with the two amendments that I have asked to be drawn up. I'd like your agreement in concept.
Madam Chair, that would be fine in concept.
Okay. Does anybody disagree? Do I have unanimous consent? Okay, when we go before the full committee, we'll have to have the amendments ready. And then I would like a motion regarding this bill.
Before your motion, and I don't, I
Senator
hope that
Locke.
the motion is favorable to me. The Hampton Newport News CSB is in my district, and I certainly wouldn't do anything that is not, favorable to an organization that I represent. And so this is a pilot program.
I get
And I would certainly hope that it would be taken in that vein.
Thank you, Senator Locke. I think we do understand that.
I had one.
Sure, Senator Bagby.
Ryan?
Ryan Dudley. Ryan with an R. Sorry.
See, how many folks do you all serve annually? You have a rough number?
With the community service?
She says she does.
I apologize. So we serve annually at our CSB about 12,000 unduplicated individuals. And that is across all of our services. So within our two cities of Hampton and Newport News, we serve about 12,000 people. Now, within our emergency services department that provides these pre-screenings, we serve usually over 3,000. As I stated last year, we conducted close to 4,000 pre-admission screenings. And this pilot, wasn't something that we were involved in the conversation about.
And how many do you all plan to serve?
Our hospital in total this past year admitted 4,011 patients. About 1,400 of those, 1,393 were under an involuntary detention order. And then our outpatient services just started this year, so those numbers are perhaps not as accurate as we want, but we're looking at about 40 patients a day.
In this pilot?
In this pilot, so anyone that walks into our emergency department, so we're, it doesn't mean that everyone would actually be under an ECO or a TDO, but we're targeting about 23 patients per day in our emergency department. Again, that varies dramatically with how many of those individuals would be voluntary or involuntary. Our target would be to certainly get as many voluntary patients as possible.
Colleagues, I think I would like a motion on this, and please include the amendments and concept, please.
Thank you, Madam Chair. I would like to move that the subcommittee recommend report of Senate Bill 34 with the amendments and concept that we'll get at full committee.
Second.
Second. Okay. Motion has been made and seconded. Will the clerk please call the roll?
Senator Durant?
Aye.
Senator Aird? Senator Bagby?
Aye.
Senator Suderline?
Yes.
Senator Favola?
Aye.
Ayes 4, noes 0, 1 abstention.
Thank you, Madam Chair.
Thank you, Senator Locke. Okay. I believe I saw Senator Hashmi in the audience. Senator Hashmi, welcome.
Thank you, Madam Chair. The first bill I'd like to address is SB 277, and we have a substitute for that, I believe.
Okay. Is the substitute coming out to us? Do you have a copy?
Madam Chair and members of the committee, this bill is really an attempt to continue to address the issue of COPN, one of our favorite topics, I know, every session. So it is an effort to bring many of the stakeholders to the table and really to also put into play the task force that was created, I believe it was 2 or 3 years ago, so that we can hopefully address the ways in which our COPN process is conducted, most especially the review and any opportunities for expedited review of any projects. And so this is the substitute that's in front of you is not making any changes to our COPN process, but it is asking our task force to develop the recommendations for expedited review, to identify which projects specifically will fall into the expedited review process, and then also an attempt to address something that is of critical concern. And I appreciate Senator Durant is trying to address this through another bill as well, and that is the issue of psychiatric services, so that we can address the mental health challenges that we have all across the Commonwealth, and to ensure that we are fully taking into consideration those issues. This particular legislation then asks the task force to meet in person at least 4 times and to complete those meetings by October 1 of this year, so that we can receive a full report and that we may be able to act accordingly next session in acting on the recommendations that have been offered to us. I'm delighted that the task force is already planning to meet in February, and we have opportunities to continue that conversation. So that is the legislation that's in front of you.
Thank you, Senator Hashmi. Do you have speakers?
If you need
somebody would like to
speakers, I
speak in
believe we have
favor,
speakers.
Please keep your remarks to 1 minute per person.
Mark Barron with the Medical Society. We appreciate Senator Hashmi for putting this bill in and working with the hospitals on a solution that allows us to meet in the off-season and hopefully get something done next year. Thank you.
Thank you.
Madam Chair, Lauren Schmidt on behalf of the Virginia Orthopedic Society, and we support the bill.
Thank you.
Madam Chair, Brent Rawlings, Virginia Hospital and Healthcare Association, and again want to thank Senator Hashmi for working with us on this issue. We have always said that we support the concept of expedited review. That is the how. The question is the what, and under the law that was established in 2020 with that task force, they're the folks that are appropriate to be helping us answer those questions. So we look forward to continuing that discussion. Thank you.
It looks like it's a complete bill. Anybody speaking in opposition to this?
Move to report.
Okay, motion has been made to report, and it was seconded. Will the clerk please call the roll?
Senator Durant? Aye. Senator Aird? Aye. Senator Bagby? Aye. Senator Suderline?
Yes.
Senator Favola?
Aye.
Ayes 5, no 0.
Okay, we will recommend to the parent committee that the bill be reported.
Thank you,
Senator
Madam Chair.
Hashmi, you have SB 231.
Yes, thank you, Madam Chair. And I just want to thank all of the folks who played a significant part of the reaching this agreement, at least in the COPN process.
I appreciate you working with all the stakeholders.
Yes, it is good to keep moving along.
Yes.
SB 231 is a bill that we're calling Cover All Kids in Virginia. And as we know, the sad reality is that 88,000, more than 88,000 children in Virginia currently do not have any health care coverage. And Virginia is actually lagging behind many of the other states. We rank 25th in the nation for the percentage of children who do not have health care coverage, and we're the 11th highest in the total number of uninsured children. Is there a there's line amendment, thank you.
Is there a second? All those in favor signify by saying aye. Aye.
Ayes 2.
Okay. Oh, the amendment's been adopted unanimously.
Thank you, Madam
Go
Chair.
ahead,
So Virginia children who are U.S. citizens have an uninsured rate of 3.8%. However, Virginia children who are holding an undocumented status are estimated to have a significantly higher uninsured rate, hovering right around 48 or close to 50%. And that is a very serious concern for us. We know that these children suffer not just in terms of health, it also impacts academic performance, it impacts future growth and opportunities that the children may have. The benefits for including all children means that we can address behavioral health issues, we can address dental concerns, we can provide preventative care at an early age. And so often, as we know, when children are not treated or their issues are not identified at a young age, these children then fall into the situation of receiving emergency Medicaid services. So it is at a higher cost if we're trying to address issues and concerns that we could treat in a preventative manner manner earlier in their lives. Madam Chair, 11 states and the Washington, D.C. have already moved to cover children in these kinds of programs, regardless of immigration status. And Utah was the latest state. You may have seen the news recently that Utah was the most recent state to pass similar legislation and create this program just this year. So this bill is seeking to address the crisis in uninsured children that we have in Virginia, and covering all kids is critically important. I'm pleased to share that just today the House companion bill passed out of the Health and Human Resource Committee on their side. So I hope we might do the same on the Senate.
I'd like to hear from a representative from DMAS, because you, of course, DMAS would have to seek a waiver. And just for people's information, waiver applications, before they're submitted, actually are shared with the money committees. So there is a review for fiscal impact and policy reasons. Jeff
Good afternoon,
Lenardi.
Madam Chair, members of the subcommittee. Jeff Lenardi with DMAS. Just one point of clarification. Really what the bill does is sets up a standalone state health insurance program that is modeled after the Medicaid program, but does not require a Medicaid waiver. It's a state-only program. There would be interaction between some of our current programs, certainly operationally, as you mentioned. There would be significant operational changes and planning that would need to go into effect, but the bill as written essentially sets up the program and DMAS would operationalize it, but it would be separate and apart from the Medicaid
That's
program.
interesting because line 53 through 55 says DMAS would be seeking all federal waivers that may be necessary. So
It does say that.
There may be some overlap with the people. That's my question. Will there be overlap with the people who are currently, the children who are currently eligible for Medicaid? Could they also be eligible for this new program?
There would be some overlap with those eligible under our emergency services, and Hope Richardson from our staff can provide a little more detail if you have specific questions on that, but that's the overlap.
So in practice, let's hope, you could draw down some federal matching dollars for some services that would be provided in this state program. That's in the weeds, but I just want to completely understand.
Hope Richardson, Department of Medical Assistance Services. We would continue to receive emergency Medicaid dollars for the children who would be enrolled. We do currently already receive that.
All right, I just wanted to make sure of that. So the bulk of the funding for this would come from state dollars. And there'd be an administrative cost as well because we'd have to set up the program. Okay. I didn't get a note from finance, but I do have a fiscal impact that's rather significant. Okay. Senator Hashmi, do you have people who want to speak in favor of this or people who want to speak in opposition?
I think we have a lot of folks that signed on, and I can just, as they're coming up, I can indicate some of the individual groups that are supportive. We've got support from ACLU Virginia, CASA.
If your group is named as supporting it, you don't need to come forward. If there are some expert witnesses, you can stand in support of this, and we recognize you.
Maybe I shouldn't name them so that they can speak.
Right.
I would like a few.
You'd like,
folks
sure,
to
absolutely.
just have the opportunity to speak in support.
So you have 5 minutes to present your case. Thank you.
Buenas noches, mi nombre es Mayra Carrillo. Estoy aquí con mi hija Aileen para pedirles que respalden el proyecto de ley basado a la salud y para garantizar la salud de mi hija y para que ella tenga un buen bienestar y tenga la posibilidad de vivir mejor.
Good evening. My name is Mayra Carrillo, and I'm here with my child Eileen, and I hope you can support this bill to ensure my child is protected. Thank you.
Thank you.
And now I am reading the testimony for Sophia, and she here brings her child virtually, Ruby. So today I want to
Whoa.
share with you the profound importance of affordable health insurance tailored to the needs of families like mine, especially during this time right now as I am pregnant. As a single mother facing economic challenges, covering all my children, including prenatal care, is of utmost importance. Access to affordable health insurance would provide not only financial relief, but only peace of mind, ensuring that my child and I receive the necessary medical attention with the burden of exorbitant cost. Today, I invite you to vote in support of this bill and to ensure that my child, Ruby, and my baby are covered. Thank you.
Thank you. I think this is a representative from VHHA.
It sure is. Davis Gammon from the Virginia Hospital and Healthcare Association. We support the bill. We want to thank the patron and all the advocates for their work on this. We believe that this is going to reduce cost and improve outcomes for patients across Virginia by eliminating or limiting uncompensated costs as it stands right now, and really incentivizing folks to receive primary and preventative care. So we really appreciate the patron again, and hope that it'll be the will of the subcommittee to recommend reporting. Thanks.
Thank you.
Madam Chair, members of the committee, Jeff Caruso with the Virginia Catholic Conference. We believe that health care is a right, not a privilege, and it needs to be accessible and affordable for all. So we support the bill, and we thank the patron.
Thank you.
Catherine Haynes with the Virginia Interfaith Center for Public Policy. It's an honor to follow my colleague at the Virginia Catholic Conference. What he said, thank the patron, strongly in support of the bill. It's a human right.
Good afternoon, Madam Chair, members of the committee. Tram Nguyen with New Virginia Majority. Want to thank Senator Hashmi for diligently carrying this legislation year after year, and we hope it's the will of the subcommittee to report and refer. Thank you.
Good evening, Madam Chairwoman and members of the committee. Thank you so much, Senator Hashmi. My name is Monica Sarmiento. I'm the Executive Director for the Virginia Coalition for Immigrant Rights. Our 45-member organizations fully endorse this bill.
Good afternoon, Madam Chair, members of the subcommittee. My name is Freddie Mejia. I am Policy Director at the Commonwealth Institute. We ask that you all please support and fund this program. We know that this would make a difference in about 13,000, the lives of 13,000 children across Virginia, and want to thank Senator Hashmi for bringing this forward. Thank you.
Madam Chair, members of the committee, Emily Moore with Voices for Virginia's Children. We also support the bill and thank Senator Hashmi for her persistence in continuing to bring this so that all of our kids across the Commonwealth can be happy and healthy. Thank you.
Good afternoon, Madam Chair, members of the subcommittee. My name is Victoria Richardson, a healthcare attorney with Virginia Poverty Law Center. We support this bill for all the reasons already stated. It's important to make sure that all of Virginia's children have access to preventative care so that small problems do not become catastrophic ones. Thank you very much.
Clark Barron with the Medical Society, and we support the bill.
Nicole Lauder at Williams Mellon on behalf of two clients, Virginia Association of Free and Charitable Clinics and Virginia Health Catalyst, and both support the bill. Thank you.
You have a motion and a second. Motion,
And
second.
it has to be re-referred to finance. Okay. Motion has been made to report the bill and re-refer to finance. That is a recommendation to the full committee.
Senator Durant. Senator Aird. Senator Bagby. Senator Suderline. Senator Favola. Ayes 3, noes 0, 2 abstentions.
Thank you, Madam Chair. If I might just say one quick final word. In 2019, Virginia hospitals went without an estimated $75 to $150 million in reimbursement costs because of uncompensated care. And so this program would help to address the issues that so many of our hospitals face. So I thank everyone that spoke in support. Thank you.
Senator Salee has asked that Senate Bill 333 and
Yes, Madam Chair, and I have a substitute if the staff may pass it out. Thank you, Madam Chair. I'd mentioned to you that maybe we should take a year to think about this a little bit more, and then last minute, everyone just got really excited about a feasibility study among a work group, and so here we are. This is what this is. Essentially, we're going to try to evaluate the feasibility of a wholesale prescription drug importation program, and we're going to have relevant stakeholders be a part of that process and see where it goes, and they'll report back to us. So happy to answer any questions.
This is a Section 1 bill, and we will have a report back, and this is a topic that has garnered a lot of attention. Are there any speakers in favor of this bill?
Good afternoon, Madam Chair, members of the committee. I'm Chris White with the Vector Corporation here on behalf of Pharma. I want to thank the patron. We were able to work on the substitute that's before you. We picked up the feasibility language that we discussed last week. We picked up what the patron wanted, and we incorporated Senator Suderline's idea on the report date. Thank you very much.
Yes, it does have the concepts we talked about.
Thank you, Madam Chair. Jared Calfee, AARP Virginia. We also support the bill. Appreciate the patrons' flexibility in working on this. Prescription drug affordability is a huge problem all across the country, but particularly in Virginia, where we pay 36% more than the national average. There's no single solution to this problem, and so we think it's a great idea for the Commonwealth to explore some potential fixes, and appreciate the patrons' work on it. Thank you.
Thank you. Is anybody wishing to speak in opposition to Senate Bill 186? Okay. Motion's before us.
Move the report.
Okay. Motion's been made and seconded. Will the clerk please call the roll?
Senator Durant? Aye. Senator Aird? Aye. Senator Bagby?
Aye.
Senator Suderline?
Yes.
Senator Favola?
Aye.
Ayes 5, noes 0.
Okay, very good.
Thank you, Madam Chair.
Let me see, our next patron, I believe. Okay, Senator Pekarsky's here, and Senator Carol Foy, you'll be next. Okay, I think Senator Carol Foy has 2 bills, and Senator Pekarsky, you have 1 bill, right?
I do.
So there was a logic to my calling.
I also have an amendment.
Is this Senate Bill 390? Thank you. Wait, this is House Bill. You didn't mean that.
No, it's so the Senate part is on the hiatus. We didn't have to print it, but it's conforming to that.
Got it, okay. Got it, okay. Senator Pekarsky.
Thank you, Madam Chair. Good afternoon, members. This bill, SB 390, establishes a SUDEP review team, which will ensure that deaths consistent with SUDEP are investigated and analyzed. Similar review teams exist for child fatality reviews and maternal mortality reviews. The team will also improve the identification and data collection related to SUDEP and make recommendations for programs to increase awareness, prevention of, and education about SUDEP. Now, SUDEP is defined as a death in a person with epilepsy that is not due to a known cause. It is not a death resulting from a seizure, aspiration, drowning, etc., but rather a label given when someone with a previous diagnosis of epilepsy is found deceased without an obvious explanation. A recent study found that 36.8% of all deaths among epilepsy patients were due to SUDEP. As a mother to a child with epilepsy and frequent seizures, I can tell you that parents like me live with the daily fear of SUDEP. That's because in individuals whose seizures are not completely controlled by medication, the fatality rate is 1 in 150. Currently, there's no framework in the Commonwealth for the investigation of these deaths. This is a huge opportunity to build understanding around SUDEP and how we can help lower the risk for those living with it. We must understand that SUDEP is not a natural death. It's a death that remains largely mysterious and misunderstood in the medical and scientific community due to a lack of documentation about the cause. This bill will help change that by providing the Office of the Chief Medical Examiner the tools it needs to investigate SUDEP cases, a necessary first step to designing interventions and preventions to reduce these deaths. I want to thank the Office of the Chief Medical Examiner and his staff, Dr. Gormley. He worked with us and took a considerable amount of time to get to where we are today because there have been attempts at legislation in the last couple of years that have failed. So I want to make sure that I thank them for all their time and efforts. No family should ever have to discover that a loved one has unexpectedly passed away due to SUDEP. And this bill is an important step towards raising awareness and better understanding and addressing this devastating occurrence. I'm happy to answer questions. I know there are people here who want to speak in support of this bill.
My apologies. I was making sure I read every word. Okay, I think we have a representative from the Autism Society to speak in favor. Please keep your comments to 2 minutes or less.
Yes, ma'am. My name is Teresa Champion. I'm with the Virginia Autism Project. I'd like to thank the patron for this legislation. I'd like to read a statement from Jill Jacobs. My name is Jill Jacobs. I live in Woodbridge, Virginia, and I've been a Virginia resident since we moved to Fort Belvoir as a military spouse. We retired from the military and stayed there. I'm asking all of you today to vote in favor of 390, the SUDEP bill, which stands for Sudden and Unexpected Death in Epilepsy. This would be a very low-cost initiative. I wish this bill had passed when first introduced in 2022, because if it had, information would have been available publicly here in Virginia, and I cannot tell you how many lives this might have impacted. My son died unexpectedly at the beginning of January due to SUDEP. And this information could have ensured that information would have been available to all of us. Deaths are currently not, the number of deaths are not currently gathered here in the Commonwealth. People have died and not been counted. This bill would remedy that. My son, Colin Alexander, died 3 weeks ago. He was just 31 years old. He was an incredible person, a loving man, a giving human being who loved his family, his community, and his life here in Virginia. Please support this legislation. Thank you.
My name is Adam Gibson. I'm here today representing the Epilepsy Foundation of Virginia. The proposed legislation to create a SUDEP review team has a complete and enthusiastic support of the Epilepsy Foundation of Virginia, and we are prepared to contribute substantial financial support to ensure the work of the review team is possible. Thank you.
Clark Barrett with the Medical Society, and we support the bill.
Thank you. Is there anybody here in opposition, Senator Pekarsky? You're aware
Don't
of?
believe so.
Okay.
I know I've reached my time, but if you would just indulge me a little bit.
Sure.
I will read very quickly, but I did have a mother that really wanted her story to be on the record and asked that I read it
Please, go
quickly.
ahead.
This is from Julie Kilo, a parent from Vienna, Virginia. In 2010, our daughter Kristen started having seizures her senior year in high school. She was so excited to be going to college as a Division I student athlete, and we were all excited with her, but very nervous because the medications she was given were not controlling her seizures. We were never told those 13 years ago that there was a chance that she would die from a seizure, and on January 13th, 2011, she went to bed in her dorm room and never woke up. It was SUDEP. These days, people are more aware of SUDEP through organizations such as the Epilepsy Foundation. Chances are you may know someone with epilepsy, so think about their quality of life, not only living with seizures, but also living with that fear and stress, knowing every night could be their last. I want to stress the importance of this bill and how it can help to find answers by producing needed data. The only way to get seizure-specific data is to pass this bill for families and parents like me that desperately want answers. After losing his sister, my son committed his life to studying neuroscience. In a few months, he will receive his PhD with a focus on seizures. He and many other researchers need more data. Think about the future. This bill can educate and, I believe, prevent people from dying like my Kristen. Please vote yes, and let's take the unexpected out of SUDEP. Thank you.
Thank you. Surprisingly, I don't have a fiscal impact. I said no budget amendments necessary from the fiscal office. Is that correct?
So,
Senator Durant.
I'm sorry, Madam Chair, I see it would have minimal fiscal impact.
And it said no budget amendment necessary right above it.
So, Madam Chair.
To the full committee, okay. All right, so we usually don't get the request from finance until the bill gets before the full committee.
Okay.
So at this point, looks like we're just voting on the content and we don't have to recommend re-referral.
Thank you. And Madam Chair, if I could just say that in the bill, this will only go forward up to the amount that is funded in public and private partnerships. So how often do people bring you money? So there you go. Just
right. It does establish that. Okay, the bill's before us. Would you like?
No, you didn't call for opposition. Okay.
I did. I did call for opposition and nobody came forward. So. Okay. Motion has been made and seconded to report the bill. Clerk, please call the roll.
Senator Durant? Aye. Senator Aird?
Aye.
Senator Bagby?
Aye.
Senator Suderline?
Yes.
Senator Favola?
Yes.
Ayes 5, no 0.
Thank you.
That will be the recommendation to the full committee. Okay. Let me go to Senator Carol Foy. You've got two bills before us. Which one would you like to start with?
Yes, Madam Chair, we can start with Senate Bill 140, Fetal and Infant Mortality Review Team. So, Madam Chair and members of the subcommittee, I believe there's an amendment in nature of a substitute.
Okay. Is there a second? Second? Colleagues, second?
Second.
All those in favor of adopting the amendment in nature of a substitute signify by saying aye. Aye. Okay. The substitute's before us.
Thank you, Madam Chair. In 2019, the Centers for Disease Control and Prevention reported there were 566 infant deaths in Virginia and 571 in 2021. Virginia ranked 26th in infant mortality rates in 2019 and 32nd in 2021 as compared to other states. While fetal and infant mortality in the United States has improved, disparities persist between whites and people of color, especially Blacks, Latinos, and Indigenous people. By creating a fetal and infant mortality team, the Commonwealth will join 29 states that have existing review operations for these types of cases. The issue is that in Virginia, we haven't seriously looked at the data regarding fetal deaths and infant deaths since 2012, when the Fetal and Infant Mortality Review Teams project was defunded and disbanded. While we have a maternal mortality review team and a child fatality review team, this additional team will fill in the gaps left by these other teams and will help create a fuller picture of the state of fetal and infant health and mortality in the Commonwealth. The bill requires the team to compile statistical data every 3 years regarding fetal and infant deaths and to make such data available to the governor, the General Assembly, and the Department of Health. The Fetal and Mortality Review Team will collect and analyze the statewide data. The hope is that in time, local and regional teams can reform to give a holistic, geographically diverse analysis with concrete policy recommendations. It is my hope that the subcommittee favorably recommends the bill to be reported. And I think I have one or two people to speak in support.
To me, in the past, we do have a section or a group or unit, is what I meant to say, that is supposed to be monitoring the fetal and infant mortality statistics. Have
What's
they
the
not been doing their
difference?
job, or what's been going on?
Yes, so the other teams cover different parts of the whole picture, with the child fatality review team and maternal mortality review team covering different deaths, and those covered by this fetal and infant mortality review team that they would cover. Without understanding the larger picture, we want to create a holistic picture and have geographic diversity in the information that's collected. So this team will fill in the gaps of what the other teams are not.
Okay, so this is filling in a gap there.
Yes.
Okay.
Madam
Colleagues,
Chair?
do you have any questions? Senator Durant?
I also have a question whenever it's appropriate.
Go ahead, it's appropriate.
Madam Chair, a question for the patron. I saw that this was, seeking to not work in a duplicative manner with the state child fatality review team. So this would create a new team that would work. I think that the goal is to work in concert together, correct?
They will be communicating, but there is a different collection of data points that they will be collecting. They will be doing interviews and researching infant deaths in a way that the other teams are not.
Madam Chair, follow-up question?
Senator Durant.
Or I guess more just expressing a concern that we're going to get into a duplicative manner, or, these independent silos end up not really, are really communicating and they're not working in concert. And I wondered, has it been explored about whether to expand and beyond the scope of that existing team to get into not really opposing what you're trying to do, but just not get into expanding in a place where we've got these two different teams and there's just confusion about what we're seeking to accomplish?
I understand, Madam Chair, Senator Durant. What I would say is you have some of these other teams that's been working for years, and so to now expand the data points that they would have to collect would pretty much undermine the progress that they've already made. So if they have direct orders to do A, B, and then in midpoint you say, now do C, D, it can compromise the mission and the purpose of what those original teams were doing. So what this review team does is not necessarily duplicative, because they are not researching, interviewing, analyzing the same necessary data points that the other teams are. We see that there are gaps and this team is needed, and so that's why we're proposing to create it.
So, I'm sorry, Madam Chair, just could they not be expanded or broadened up to ensure that they are collecting all those data points that they're not doing right now, so that there's a more efficiency with the team that's already dedicated and committed to working on this issue?
Madam Chair, Senator Durant, well, what I would say is those teams already are established and they have their purpose and their mission and what they're supposed to be collecting, the information they're gathering, and they are funded to do what they're supposed to do. And so now it would be harmful to their mission to say, now we want you to veer off and do something different or collect these different data points when they don't have any type of direction or guidance or guardrails on what that looks like, and they weren't formed for that purpose. So it's more efficient and effective to have this separate team who will fill in the gaps and do something different than what they are already, this other team was
Madam
established
Chair.
to do.
I have a question as well, but yes, Senator Aird.
Madam Chair and Senator Carol Foy and Senator Durant, I think, if I might, guess what? We have a bill for what you're trying to do. It's not on this docket, but you will hear a bill before this committee that actually speaks to the development of a 5-year strategic plan, and that would help further inform the work that this team that she's referencing does. And in that legislation, you'll actually see it laid out as specifically what that strategic plan must cover, so that it gets at the point of really assessing whether or not these teams are equipped to actually capture and do the work that we are asking them to do. So I think that both of these will work together in tandem.
I appreciate that. Thank you very much, Madam Chair. Senator Aird.
And I have one other question, and this is to the patron or to General Counsel. I believe the Centers for Disease Control actually have required certain certain categories of information in the fetal and infant mortality area. So are we also attempting to comply with federal law on this?
Madam Chair, what I would say is that this infant and maternal mortality review team that's created, they are, I guess, ordered to have interviews. They are ordered to research infant deaths, maternal deaths, in a way that is separate and apart from what any other entity that we know of is doing. Now, what the CDC is doing or other agencies are doing, I'm not sure. But I know for the review teams that we have, their functions have been created by the General Assembly. And a lot of this is to the point of addressing Black infant and maternal mortality.
I'm sure this is going to give us more granular information.
It does, yes. Yes, Madam Chair.
Okay. I will also research what the federal requirements are, too. Senator Suderline.
Thank you, Madam Chair. I've got a question for the patron, or possibly for council. I don't care who answers it. In the enactment clause, it says that the team established pursuant to the code section shall be contingent on ongoing funding, and the team may, at its discretion, alter its work to meet budgetary constraints. So does that mean if it's simply not included in the budget 1 year, then it ceases to exist?
Madam Chair, Senator Suderline, what I would say is yes, this team is dependent upon the funding, and that is something that we're going to be requesting as well.
And Madam Chair?
Senator Durant.
A question I just generally put
Yes,
is
ma'am.
that I do not see budget amendment. Is that in the same posture that it would go for full committee then?
Madam Chair, Senator Durant, we did submit a budget amendment for $250,000 for the year of 2024 to 2026.
And I will just say the language in lines 907 to 913, that we commonly use that, so the lack of funding doesn't hold up the bill. So she's trying to establish the team, and get it in statute, and then if funding comes, funding comes. But that was probably the strategy, if that's your question, Senator Durant. Thank you.
I have another question.
Senator Suderline.
Thank you, Madam Chair. I've also on page 34, near the top of it, it mentions basically maintaining the privacy of the families that have been affected by this, and it says the violation is a Class 3 misdemeanor.
Yes.
What do we usually have as the penalty for folks doing that? I don't spend a lot of time on
Courts of Justice.
correct, wisely. Madam Chair, just to elaborate a little more,
Senator Suderline.
I have no idea if that is if that's in line with our usual punishment or not. It seems a little light if they're giving out this information.
Do you have a?
You should say so everyone can hear.
Yeah. I mean, the thing is, somebody can do it inadvertently. Privacy laws are fairly complicated, so you don't want to. Yeah, Senator Aird.
May I ask the patron whether or not there is a particular reason we're introducing the Class 3 misdemeanor, or whether or not this exists within the current team as it's structured?
Madam Chair, Senator Aird, yes, thank you for that question. It does, that language does exist in the existing maternal and infant mortality review teams that have been already established and codified by the General Assembly. So that's standard language.
Okay, yeah. Yes. Julie, go ahead.
Madam Chair, just briefly circling back to the question regarding the Class 3 misdemeanor. That is actually a penalty that is already in existing law for the state child fatality team and the maternal fatality team.
Okay.
So this is not a brand new
It's not new.
heightening of.
Yes, that's what.
Yes, correct.
Okay, now, I'm going to ask if you have any speakers in favor of the bill. Anybody's in favor, please come forward. And if anybody's in opposition, you will also.
Well, thank you very much, Madam Speaker, members of the committee. My name is Tammy Miller Jennings. I'm here representing Virginia Now, and we do support the bill, and we thank the patron for bringing it. We believe it does serve a specific area that really needs a greater lens. So we would please appreciate your support. Thank you.
No, Madam Chair.
Shouldn't we, Madam Chair, since we know that it has to have funding to make it work, shouldn't we just automatically recommend, report, and refer to finance? So we make sure that it has the money?
We never know what finance is asking for till the parent committee. We would do that at the parent committee.
Right, I understand that finance might not have requested it, but the bill says that it won't happen if it doesn't get the money.
Well, no, the bill says that actually they're going to establish the office, and then funding will come whether it's appropriated or not. So that this bill establishes the office.
It says it's contingent on the funding. So I think we should send it there to make sure they give it the money, otherwise.
Madam Chair?
We can make that in our recommendation, but again, that's the parent committee that'll do it. Yes, Senator Bagby.
I certainly agree on that point, but I just think what you just said related to sending it to finance at the next meeting in the full committee is the proper fashion.
I think that's right.
But I certainly agree.
We'll wait for finance. Maybe their eagle eye will miss this. Okay, the motion has been made and seconded. Will the clerk please call the roll?
Senator Durant? Senator Aird? Senator Bagby? Senator Suderline?
Yes.
Senator Favola?
Aye.
Ayes 5, no 0.
Okay. Senator Carol Foy, you have Senate Bill 499.
Yes, Madam Chair, members of the subcommittee, before I begin, I believe on Senate Bill 499, donor human milk banks, health insurance, I have an amendment in nature of a substitute. However, I believe the edits are not ready, so it can be reported in concept. That would be great.
Well, we'll have to understand what the edits are. Senator Aird.
Madam Chair, is the patron able to describe what the amendments would be?
Yes, the clerk has.
Oh, okay.
Go ahead, Julie.
Yes, thank you, Madam Chair. As Senator Carol Foy was explaining, the draft is prepared, but it's not quite through our proofing and review processes yet, which is why it is not public at this time, although it's a little bit more than in concept because it has been fleshed out. Essentially, the substitute establishes, it adds several sections that create a regulatory and licensure scheme for these donor human milk banks. It adds certain definitions, it adds licensure requirements, and makes it a Class 6 felony to operate without a license. It also establishes the authority to enter into licensure agreements with licensed human milk banks that are licensed in other states. It establishes certain regulations relating to the collection, storage, and distribution of human donor milk. And those include the establishment of certain health and hygiene standards. It establishes procedures and requirements relating to inspections for applicants for licensure, licensed donor human milk banks, and for renewal of licensure. It establishes certain record keeping and reporting requirements for licensed donor human milk banks. and it has certain protections for complainants, including confidentiality of their identity, protection against retaliation or discrimination, and it contains provisions relating to disciplinary action for violation of provisions of the bill or
Madam
regulations.
Chair, just so council
Senator
doesn't have to
Suleman.
keep reading.
These aren't just a few concepts here and there. This is a whole amendment in the nature of a substitute. And for the comfort of the committee is really that we take this by for the week so we have time to actually look at the language.
I totally understand, Madam Chair.
Okay, thank you. Is there a motion to take it by for the week? All those in favor signify by saying aye. I think we're all in agreement. So thank you, Senator Carol Foy, and we will see you next week.
Thank you.
Okay, just another announcement. Senator Durant, your bill 404, you're taking it by for the week, okay? All right. All those in favor of motion to take Senator SB 404 by for the week?
So moved.
Second? All right, all those in favor signify by saying aye. Okay, that reduces our agenda a little bit. Okay, so now, colleagues, the only items before us are items that our members of the committee want to present. So, Senator Aird, let's start with you. I'm going alphabetically.
Thank you so much, Madam Chair, members of the committee. Before you is Senate Bill 488.
Yes.
Thank you so much. Members of the committee, Senate Bill 488 removes burdensome regulations that prevent parents from receiving compensation as caretakers for their developmental disability waiver recipient children. Madam Chair, under current law, the Virginia Department of Medical Assistance has developed qualification criteria for parents seeking payment as caregivers to their children that make consumer-directed care by the parent, known as the legally responsible individual, or LRI, less accessible for Virginia families. For instance, one of the new regulations only allows a parent to receive compensation after they have demonstrated that no other options through the private sector, either an agency or consumer directly hired individual, are available to provide care. And we have heard from significant families that this has proven to be quite burdensome. Madam Chair, we are essentially telling these families that we don't think they, as the parent, are the best equipped person to take care of the very specific and nuanced needs of their children. And so, Madam Chair, for families which have more than one child who is a waiver recipient, the practice also is that these parents are capped at 40 hours, the same amount they would get if they only had one waiver recipient children. And so we seek to address that here in this legislation as well. Related to this, Madam Chair, we're hoping that we can take these new approaches as outlined in the bill and lessen some of the burden that these parents and these families are experiencing so that we can continue to support parents who are caring for their children.
Thank you, Senator Aird. Actually, members of the Disability Advisory Commission got a pretty thorough briefing on this. There's the DMAS did issue a regulation in this area, or was about to. And Mr. Lenardi, would you like to comment? This is a Section 1 bill, and you're just asking that there be a modification for the 40-hour work week to allow some legally responsible adults to be caretakers. And actually, it would be, go ahead.
Thank you, Madam Chair.
Has to be approved. Go
Jeff
ahead.
Lenardi with DMAS. We appreciate Senator Aird reached out to us, and we had some conversations with her about this bill heading into session. Certainly, the administration's perspective on this is, if it's the will of the General Assembly, to direct DMAS to modify its current waiver plan that has the guardrails in place that would enable families to continue to take advantage of this, that we will work with CMS to apply for those changes, and if they are approved, we will implement them. So the current plan does have specific guardrails in place. That plan will go into effect March 1st. I just want the subcommittee to be aware of the timeline here. And then if the General Assembly directs us otherwise, we will apply for those changes to CMS and implement them as soon as possible. If you have specific questions, we have Ann Bevan here from DMAS who can speak to a little more detail.
It's a little bit more complicated than you might think. We certainly do want to empower the caretakers, the family members who are with, you know, a loved one 24/7 and can actually provide care. But the federal government had raised concerns about quality and oversight, and the assurances that the child with the disability was actually getting good care. So I don't think this bill would necessarily remove guardrails. I don't read it quite that way, but I'll ask Senator Aird.
Madam Chair, thank you so much. I believe that the guardrails are absolutely still in place, but this allows it to be more manageable and supportive of caretakers and family members operating under this structure.
So I guess what I'm looking for is how would this Section 1 bill interact with your regulation that's currently currently going to be issued in March, I guess.
Right. Ann Bevan with DMAS. What is currently in place and what we ask for the variance that goes into effect in March has requires family members with their support service facilitators to show that they have tried other options and that they are the last resort, and that it's not a self-referral process. And that was also CMS saying these are some of the guardrails that need to be placed. We need to ensure that there aren't self-referral processes in place.
And Madam Chair, just to be clear, so this legislation is asking to eliminate that, because ultimately the examples that have been provided to me from families is that they're having to go through advertising, they're having to go through numerous efforts to find someone to prove that they're not the best caretaker, basically, to provide for their families. And I think as a mom in general, to have to prove that that is the case, particularly for caring for a child under these circumstances, is unnecessary and burdensome. And I'll just add that as a military state where we have a lot of military families that are transient, those families that are coming into the state or moving around, it's especially burdensome for them.
That's one guardrail. Are there other guardrails still be in place? I mean, I just want to give the committee a full understanding of the the issue. Go ahead.
So those were the two main ones. And again, like Jeff had said, we'll seek whatever you ask us to do and work with CMS to make those happen. There's also the parents that are the EORs. There's a limitation there as well. So that's the other guardrail.
And then, Madam Chair, if I may, just
Yes.
from a
Yes, Jeff.
authority perspective, I think what Ann was saying is we can't guarantee you that CMS will approve waiver changes based on what you direct us to do. We just want to make that clear. The second thing is the removal of sort of what we would call the provider of last resort provision, which is paragraph 2 here. There is budget language that the General Assembly put in 2022. It is carried forward into the current budget that directed us to continue this flexibility and specifically directed us to include the provider of last resort. So I'm sure Money Committee staff could reconcile that with whatever bill might move forward, but I wanted to flag that we need both federal authority and we need state authority to make any necessary changes.
Yeah. I do like the flexibility, but I am very cautious about also having guardrails. So Senator Aird, do you have speakers in favor of the bill?
Yes, Madam Chair. Yes, Madam Chair.
Please come forward. Please keep your remarks to maybe 1 minute or less.
Yes, we actually, in the interest, only chose, these families came last week and this week, so I'm going to go fast on a couple technical things. Tanya Milling, the Arc of Virginia Executive Director. Guardrails, we absolutely recognize there has to be a process. I'm sorry, I'm getting over a cold. So I do want to say with the last resort, hopefully that can easily go away. We looked at 8 other states. There are no other states that have that in the 8 we looked at that already have CMS approval. Again, as you said, nowhere else in our society, the court system, CPS, you name it, are parents not the automatic first assumption of best. The other thing I wanted to say, employer of record is one of those other issues The employer of record I couldn't find in other states because Virginia has a very unique way of doing this service. So this guideline would say that one EOR cannot, one LRI cannot be an EOR for the other. However, the goal of what we're trying to resolve there is not getting resolved because EOR is an unpaid position, so no one's going to do you that big favor and take on that risk and liability for free unless it's somebody that you could perceive as having an inherent bias. Thank you. And last, I hope that we are able to roll these things in. We love both patrons, and perhaps the respite piece in Senator Suderline's could be rolled into Senator Aird's. Thank you.
Next, you can just say that you're in support if the points were made. We understand. And just tell us what group you represent. Maybe give us your name, the group you represent, and tell us that you're in support.
My name is Erica Rogers. I'm a mom to 10 children. 4 of them have Down syndrome. I am in support of SB 488 and SB 149. Thank you.
Good evening. My name is John Sagal, resident of Fredericksburg, South Stafford. I am a parent of 2 special needs children, fully, strongly support of both of Senator Aird with your bill, along with Senator Suderline. Appreciate your all's time tonight. Thank you.
Senator Suderline, yours is different from Senator Aird, so it's just to be clear.
Hi, I'm Abby Deeney. I am the Advocacy and Mobilization Director with the ARC of Virginia and a parent to 2 special needs children.
Thank you.
My name is Donald Benson. I'm the foster father and now currently adoptive father of a 4-year-old child that was abused and is now using a CCC plus waiver, and these guardrails are preventing us from being able to do what we need to do for our child. So I am fully in support of this bill.
Okay. Anybody else want to state their name and the organization they're representing? Or
Madam Chair, Randy Pearson with Two Capitals Consulting here on behalf of the Autism Society of Central Virginia as well as the Autism Society of Tidewater, Virginia. We strongly support the bill. Thank you.
Okay. Yes.
Thank you, Madam Chair. Jen Kraske with the Virginia Board for People with Disabilities, and we support this bill as well.
Okay.
Thank you, Madam Chair. Tammy Miller Jennings with Virginia Now. Thank you for your thoughtful questions, but we do support the bill, and we kindly would echo the comments previously made by Senator Aird. Thank you.
Okay. Thank you. Is anybody in opposition to the bill? Okay. Hearing none, the debate or conversation is with the committee.
Madam Chair, procedural question.
Senator Aird.
Madam Chair, given that Senator Suderline's bill has one additional element to it, I don't know if you want to also hear his and then decide how we will proceed.
Well, I would have liked to have put them both together. It would have made some more sense.
I invite Senator Suderline to join me.
I was going to suggest that. But traditionally, when we roll something together, the lower number bill takes precedent. But by joining these, I would want both contents. Senator Suderline.
I'd be happy to take the content of mine and let it go forward with Senator Aird's bill.
Okay, so why don't we say that Senate Bill the content of Senate Bill 610 is an amendment to Senator Aird's bill. Please.
No.
No, I was adding it.
Senate Bill 149.
Okay, my apologies. Senate.
You need to report 610 on its own.
Okay, Senate Bill 1, you're correct. That was my mistake. So Senate Bill 149, the content would be incorporated into Senator Aird's bill. Has an amendment.
I'd like to make that motion.
Second.
Okay. Motion has been made and seconded. All those in favor signify by saying aye. Aye. Okay, great. So.
I now move to report this great bill.
Make them both chief co-patrons. So Senate Bill 488 is being reported as amended. And there was a second. Will the Clerk, please call the roll.
Senator Durant.
Aye.
Senator Aird.
Aye.
Senator Bagby. Senator Suderline.
Yes.
Senator Favola.
Yes.
Ayes 5, no 0.
Okay, so that makes me feel better. Thank you, Senator Aird. I don't see anything else from you on this. No. Okay, now, Senator Suderline.
Thank you, Madam Chair. I've got Senate Bill 610 for the
Correct.
consideration of the subcommittee.
Correct. And I thought you had a note. Yep, and that will be our last bill according to my notes. Okay.
And so this bill comes
ahead.
from Senator Pekarsky and I. It's also got the companion House legislation, and it seeks to ensure that our folks that receive a DD waiver slot don't lose that slot simply because there's not a service provider immediately available. So currently, you're able to get these 30-day extensions if you can't find someone, and then it goes up to 150 days in total. And what my bill seeks to do is extend that for 365 days to allow folks to maintain their family slot for their family member that needs that, so they don't lose out on it. And then also, it includes a sunset of June 30th of 2026.
Correct.
Which hopefully we have more bandwidth and service providers by then. But I'll be up front, and if we don't by then, I'm still going to want to extend it, so we'll have a different bill later. But hopefully we have more service providers by then, which is a challenge, as you know, Madam Chair. So that's the bill. It's pretty straightforward. There's some folks from the ARC here that are supportive of it, and I don't know anyone that's against it.
Thank you, Senator Suderline. I would like to call the TMAS forward. Is a representative here? Okay, so I just want to understand the bill. It's a Section 1 bill. It's a Section 1 bill. So if you're amending your regulations to allow for support coordinators to request and subsequently obtain approval of a consecutive waiver, is that possible?
So right now, we'll have to ask CMS as well. It would be also part of our amendment. Right now, if a person gets a slot, they have 30 days to use it. If they can't find someone to serve them and help them, they get 30-day extensions, as Senator Suderline explained, up to 150, with the influx of potentially many, many slots, capacity issues. So it would allow them more time to continue to do that.
This would allow them 1 year.
Up to 1 year.
Up to 1
year.
year. I mean, that's a lot. And
it's essentially another 6 months.
Sure, because they would get got it. They've already got in your regs a certain amount of time, and this would be an additional 6 months. Correct.
And Madam
Okay.
Chair, I think
Yes.
there's also a technical amendment that I hope is at the council's desk.
Yes, Madam Chair.
Go ahead.
This would be on line 14 of the bill.
Got it.
We would be striking the word "of" at the end of that sentence and inserting "up to." So the sentence would read, "for a period of up to 365 days."
We didn't have the up to in our, so that's why I was surprised. One other question. How will this affect the people who are on a waiting list? And so a slot is going to be sort of banked, essentially, for 300.
Right, so the slots are designated to individuals. People on the waiting list have to wait for a slot. If a slot is being held for me until I can get services going, that slot would not be available to anyone else.
Right. No, I understand. So that's my point. There could be somebody else who could get a provider and yet would be waiting.
It could, but there are a lot of different services available in these waivers, not just one, right? So there are a multitude of services.
Okay.
A person doesn't have to start the full array of services that would meet their needs. They just need to start at least one service.
Okay, well, that clears it up. Okay, colleagues, could we adopt the amendment up to? And Okay, all those in favor signify by saying aye. Aye. Okay, so now the bill's before us. Anybody wishing to speak in favor, just come up and say why you're speaking in favor.
Hi, Tanya Milling with the Arc of Virginia. Thank you so much. Yes, it really is, as they said, we've gone with all of the new waivers coming in. There is a workforce, there is a provider issue, and there are a lot of things in front of us this year, funding amendments to build provider capacity. So this is, and that's why it's also sunsetted, is that opportunity to we have 190 people who are at their 150 days right now. So we want people to be able to hold on while we build capacity. Thank you.
Madam Chair, Randy Pearson, Two Capitals Consulting, again on behalf of the Autism Society of Central Virginia and Tidewater, Virginia, we strongly support the bill. Thank you, Senator.
Thank you.
Madam Chair, members of the subcommittee, Ariel McAloon with Fairfax County, and we support the bill.
Thank you. According to my fiscal impact statement, there's no fiscal impact.
Nope.
So I don't see anybody in opposition to the bill. Okay. All those in favor to report the bill as amended signify by saying, we can signify by saying aye, or the clerk can call the roll. Okay,
Senator
please.
Durant? Aye. Senator Aird?
Aye.
Senator Bagby?
Aye. Have as proxy.
Senator Suderline?
Yes.
Senator Favola?
Yes.
Ayes 5, no 0.
Okay, I will, according to my notes, this completes our meeting agenda, but I will ask staff, is there anything before us that I did not address or did not?
No, Madam Chair.
The meeting's, okay. All right, motion to adjourn is in order.
So moved.
There's a second. All those in favor say aye, and you may leave. Thank you.